All right, everyone, we're going to get started. Thank you guys so much for coming. For those who maybe missed the intro, I'm Marissa Sosky. I'm the president of the Student Alliance for Integrative Medicine. Thank you guys so much for being here. This is an awesome attendance for this event. We really appreciate all of you being here. Just thank you to all of our speakers who have spoken before. I'll introduce our keynote in a second. Before I introduce the keynote speaker, I have a couple more people to thank. I want to send a big shout out to the board members of our parent organization, the Oregon Collaborative for Integrative Medicine. So if I say your name, please stand up so we can give you a round of applause. Samantha Simmons, Joseph Brimhall, David Schleich, Amy Copeland, and Beth Howlett. If you're in the room, thank you all so much for your support. We couldn't do it without our parent organization, and we really appreciate them and our relationship with them, and so thank you guys so much. I would also like to announce that we have a new president-elect for this coming year. We have a transition in leadership within the at IM Day, so I will be continuing on as president, but we have a new president-elect, Christine McClure. Just a reminder that there will be a raffle and t-shirt sales going on at the beginning of the social. I highly encourage you guys to stay. There will be some drinks and live music and food, and it's going to be a really good time. So now I would like to call up Heather Zwickey. Dr. Heather Zwickey is a PhD trained at the world-renowned Jewish. No, sorry. Let me start over. Nerves. I'm usually really good at this. Trained at the world-renowned National Jewish Medical and Research Center in Denver. She earned her PhD in immunology and microbiology at the University of Colorado Health Sciences Center. Dr. Zwickey went on to complete a postdoctoral fellowship and teach medical school at Yale University. At the National University of Natural Medicine, Dr. Zwickey launched the HealthGot Research Institute and established the School of Graduate Studies, developing programs in research, nutrition, and global health, among others. She currently leads an NIH-funded clinical research training program at NUNM. She teaches immunology and nutrition at NUNM and at the University of Western States and Maryland University of Integrative Health. At HealthGot Research Institute, Dr. Zwickey applies her immunology expertise to natural medicine. She studies the immunological and neurological mechanisms involved in nutrition, herbal medicine, acupuncture, and mind-body therapies, with specific interest in the gut-brain axis and Parkinson's disease. Also, on a personal note, she is the one who recruited me to come to NUNM, so thank you. Thank you. So without further ado, Dr. Heather Zwickey.
Okay, yeah, we're ready to go. Thanks, Marissa. Okay, so Marissa gave me this topic to talk about. I said, what do you want me to talk about? Because last year I talked about the state of the science, and that's really kind of my forte. And she said, oh, I want you to talk about the future of integrative medicine. Right. The future of integrative medicine, that's hard. I mean, we all know how hard it is to predict the future, right? Just look at the weatherman. Or astrology, or somebody looking into a crystal ball. I'm none of those things. I'm not even really as good as a fortune cookie at predicting the future. I'm really good at living it, but I'm not that great at predicting it. So I had to come up with a strategy, which is what I do for everything. I said, okay, well, how would I predict where medicine is going? And I have the advantage of having talked to a number of colleagues in the industry to find out what they think and where they think integrative medicine is going, but where medicine is going as well. Because as part of medicine, we have to look at the whole picture and then see where we kind of fit in as we move along. So how do we make predictions? Well, typically what we do when we make a prediction like this is we would look at the past, and then we'd assess the present, and then we think about our future ideals. Where do we want to be? So that's going to be how I approach this talk. We're going to look a little bit at the past. We're going to take a snapshot of where we are right now, and then let's talk about what our future ideals are versus what path we're on right now. So looking at the past, if we look at the past of our natural medicine modalities, really what we're looking at is where did we come from? And the most ancient modalities that we came from were herbal medicine that were used, long before we think of things like caveman days. So our world medicines are really focused on herbal medicines and bringing them into the future. Now, as we leap forward by thousands and thousands of years, then we get to where we are in the United States. And if you look at where integrative medicine is really focused, it's the West Coast. The West Coast has far more integrative medicine than the East Coast has. Yes, there's integrative medicine in Massachusetts and Connecticut and Vermont, but on a per capita basis, on the number of people who use integrative medicine, really California, Oregon, and Washington outnumber the rest of the country completely, if you look at the statistics. So we start on the west and we move our way east. When we hit the East Coast, we hit the NIH. And the NIH is an important group to talk about because that's who funds integrative medicine research. And if we're talking about integrative medicine research, that's really who's setting the standard of what is integrative medicine. They like to think they set the standard anyway. So we have to look at where the money's coming from, and the money is coming from NIH, although right now the money is not coming from NIH because NIH is shut down, just like the rest of the government. So where the money would be coming from were NIH not closed. We also have to think about what integrative medicine is. And integrative medicine is a collection of practices that are multiple different professions. So you have Ayurvedic medicine, anthroposophical medicine, Asian and Oriental medicine, chiropractic, naturopathic, Unani. A variety of different types of medicines make up the collection of integrative medicine. And all of these are professions in and of themselves. If we look historically at what we were treating with integrative medicine, the number one thing we were treating was infectious disease. And our flu outbreak this year reminds us of how bad infectious disease used to be. So we started out treating infectious disease. As time progressed and we got the Industrial Revolution, we now saw chronic upper respiratory disease. And then our integrative therapies had to treat upper respiratory disease. And as we have progressed, and as you've heard earlier today, we've now moved into more of a chronic disease state. So metabolic disease, arthritis, more chronic disease are prevalent in this country and industrialized nations than infectious disease. It's interesting because if you look at countries with low economic resources, they're all going through this same process that we went through. As they progress, they start with infectious disease being the number one thing that's being treated, and then they move into upper respiratory disease and finally into chronic disease. So as we move through, we go through all of these stages. So let's look at our health today and just take a snapshot. What do we have going on today? We have an opioid crisis. Okay, that tells us there's a lot of people in pain. We also have environmental toxicity that we're dealing with, whether we're talking about lead poisoning in Michigan, or we're talking about pesticides and herbicides, or we're talking about the drinking water in LA having benzodiazepines in them because we don't have filters to filter out the drugs out of our drinking supply. We've got a lot of environmental toxicity that we have to think about. We've got a mental health crisis that's ongoing right now as well. It contributes to our homeless situation that we have, but it also contributes just to happiness in our society. And we have an obesity crisis that's happening in the health today. And we talked earlier about the sedentary lifestyle that has been established. And so there's my little couch potato representing our sedentary lifestyle. If you talk to the NIH, what they will tell you is the number one health crisis that they're seeing is pain. If you look at the statistics, if you look at why people are seeking alternative care, is that they aren't getting served by conventional care, and they're not getting served by conventional care for pain. So pain is something we really have to think about then moving forward. Now, We can think about pain from the perspective of treatment of pain, or we can think about pain from the perspective of prevention of pain. And depending on which modality you practice, you may think about it a little bit differently. Our national health statistics report that more than half of Americans have musculoskeletal pain. 40% of people are using integrative medicine for their pain. And the most common pains are neck pain, low back pain, sciatica, and arthritic conditions. So if you focus your practice on pain, you're going to be successful. There's plenty of people out there with pain. The other thing to look at as we're looking at today is we have to take a snapshot of what does integrative medicine mean today. Now, your first talk today was about integrative clinics and the challenges to being a practitioner in an integrative clinic. Integrative medicine today has a really diverse meaning. It's a specialization within biomedicine, and the first couple of specializations came through AIHM, the Academy of Integrative Health and Medicine out of San Diego. There was also a fellowship at University of Arizona, and Andrew Weil's fellowship. So those were our two first specializations. But there's now 18 new integrative medicine fellowships at conventional medical schools. It's a lot. We also have 64 integrative medicine programs at conventional medical schools. Okay? So if we're looking at what has been happening and where we are today, integrative medicine is hugely growing in the conventional medical world. What is integrative medicine at a conventional medical school? Well, in some cases, it's a mindfulness-based stress reduction class that's being offered. In other cases, it's a physician who might also give an herb. They might replace a drug with an herb, or they might give an herb in addition to a pharmaceutical. And it's physicians who do acupuncture. That's currently how integrative medicine is practiced in a conventional field. But we also have professions that are integrative medicine. And our professions that are integrative medicine have not been classified as integrative medicine necessarily by the medical system. So there are certain things that you can be treated for and get insurance coverage, like naturopathic medicine, chiropractic medicine, but there's Ayurvedic medicine, which is not licensed in this country, and so it cannot be covered by insurance. So you have various integrative medicine practices that are not yet fully licensed in the United States. And we have very few examples where the conventional biomedicine is actually truly integrated with the integrative medicine professions. Very few examples of that working successfully. And last year, this is really interesting, because last year I told you about one of the successful marryings of conventional medicine and integrative medicine, and in a year's time, it has gone away. So last year we talked about a hospital in Minnesota called Abbott Northwestern under the Allina Health Systems, and they had a 400-bed hospital that had integrative healthcare shifts. And they have since discovered that it was not making enough money, and they did away with it. So there it goes. So that tells us something else. It tells us that we have to fit into a financial picture that our society is willing to support. Integrative medicine today means, from NIH's perspective, it means herbs and supplements, and it means mind-body medicine. Now, that's interesting because in the naturopathic arena, primary care is something that NDs provide. But as far as the NIH is concerned, that's not integrative medicine. And so now when we start to study a whole system of medicine like naturopathic care, we've got to try to sort out what the integrative medicine components are as opposed to the primary care components. It's becoming more and more confusing as these two fields are starting to merge. And as I mentioned last year, once there's enough evidence for any type of integrative medicine, the alternative becomes mainstream. And where we've really seen that is with fish oil, with mindfulness-based stress reduction, and with probiotics. Fish oil was something that 20 years ago, NDs and chiropractors used to give people, and now pretty much every conventional practitioner is giving out fish oil. Mindfulness-based stress reduction, just 10 years ago, was something that was huge in the integrative medicine field, and now conventional medical schools are actually teaching it to their medical students more often than naturopathic and Chinese medicine students are getting that education. Isn't that interesting, right? And probiotics, something that even as soon as 5 years ago was something that was just starting to hit mainstream, now is in almost every commercial that you see. There's probiotics. So as things develop an evidence base behind them, we actually see that they become more mainstream. And then they're accepted by the mainstream medical model. And with respect to probiotics, one of the things that we'd have to acknowledge is huge today is the microbiome. Microbiome is getting focus from both natural medicine and it's getting focus from conventional medicine. And so we're starting to see how these little gut bugs control everything. Everything from your gut to your brain. And certainly we know that there's a strong relationship. But 15 years ago, when I started at National University of Natural Medicine, there was a bumper sticker that one of the professors had on his door, and it said, "It all starts in your gut." And that is certainly not what conventional medicine believed. And now today, if I were to take that same bumper sticker and put it on the wall at OHSU, everybody would go, well, of course. So we've really changed what we believe about how medicine happens and how health happens, because we're starting to understand the importance of gut bacteria. Okay, so with that as context, what's the future? I wish I knew. Well, the first question is, what will we be dealing with? So what I want you to do for just a second is think to yourself, what do you think we're going to be dealing with? And ask the person beside you, what do they think they're going to be dealing with? What are you going to be dealing with in the future? Okay, lay it on me. What'd you come up with? Spreading integrative medicine through the entire country. Yeah. Okay, what else? Reimbursement. Yep, that's something you're going to be dealing with. What else? Dementia. What else? Absolutely. Mental health issues, chronic pain, anxiety, depression. I'm an immunologist, so I love that because those three things are all caused by the same cytokines, IL-1, IL-6, TNF-alpha. You treat those, there goes your pain, there goes your anxiety, there goes your depression. So chronic inflammation, let's treat it. What else? Okay, I'll keep going. I'm making you uncomfortable, which I don't mind doing to my students, but not all of you are my students, only some of you. All right, so here's what I said. I said, well, let's start by looking at the context. And the context is we have an aging population. That is to say, we have more people getting older than we have new babies coming into the world. We have an aging population. And we also have climate change. And climate change is actually a significant influencer of health. And we have the information age. And that's a significant influencer of health. So this is our context. Let's talk about what I mean by each of these things. First of all, with respect to our aging population, we have an increased need for long-term care services. And when I say that, I want to clarify that because it was a great panel right before this and talking about aging. And one of the things that was brought up was the need for medicine to go to people rather than people to have to go to medicine. And certainly if you read about this, that is one of the trends. One of the trends is home care. mobile services, and not just mobile medicine, but mobile food services, mobile athletic services. Pretty much, we talked in the last session about people who are elderly not liking to go to the grocery store. Well, guess what? Amazon is going to take advantage of that, right? So mobile services for an aging population is actually one of the big things that's going to be expanding, and you're going to see that very soon. We also see with an aging population that we've got chronic health issues and comorbidities, which makes integrative care more complex, because it means that our patients who are coming to us have multiple things that they're taking already, and now we're adding on top of those things. And so there's a discussion happening around how do you take things away. And we know polypharmacy is an issue. Everybody knows polypharmacy is an issue. But how do you remove the polypharmacy with adding health in a safe way? And even conventional doctors are starting to have that conversation because they're concerned about polypharmacy. And then finally, when I think about aging population, I'm thinking about cognitive issues. And we know that the two fastest growing disease populations right now are Alzheimer's and Parkinson's. So recognizing that memory is an issue, and it's an up and coming issue, knowing how to treat memory issues is going to be important for the physician of the future. How does climate change impact health? Well, one of the things we're seeing with climate change is we're seeing emerging infectious diseases. We're seeing things that used to not live in certain areas because geographically the viruses did not survive there, but now with rising temperatures, they do survive in certain areas. So if you look at the yellow fever map, for example, you'll see that yellow fever has expanded where it's currently infecting people because more places are warm, and you can actually get viral reproduction. We also see a huge issue with air quality as we think about climate change. So you know how I talked about moving from infectious disease to upper respiratory issues? Look at that, emerging infectious disease, upper respiratory issues. It looks like we're moving backwards when we think about climate change. We also have extreme weather-related events that happen with climate change. As such, we see more natural disasters, and we need physicians who are capable of handling natural disasters and handling the post-traumatic stress that goes along with the natural disasters, as well as the health issues, the waterborne illnesses that come along with natural disasters. And that's the next thing on the list, is waterborne illness. We're expecting that we will see more waterborne illness as we see additional flooding in different locations. And finally, this question of food safety and nutrition. So here we have a climate that is changing, and we have optimized our crop growth for our current climate. We are likely going to have to change how we grow food if we are going to continue to feed as many people as we do with respect to having truly nutritious food. Already that we're seeing that the soil's depleted. We're seeing that an orange that 20 years ago would have had an RDA level of vitamin A now has 1/8 the RDA level of vitamin A. You'd have to eat 8 oranges, right? So that obviously doesn't work for us. So how are we going to get the vitamin and mineral RDA levels that we need? And most NDs will tell you you need more than RDA levels anyway. So, so this question of food safety and nutrition. Now, what's interesting is that probably the way that we're going to get that is through GMOs. And yet most of the natural medicine community is completely opposed to GMOs. So here we have a clash in culture that's going to necessarily happen, because if you want to feed large numbers of people and you have climate change happening, you have to have crops that are going to grow. We've got some things that we're going to have to deal with here. All right, information age. How is that going to impact our future? Well, we're already seeing sleep disorders happening from all the staring at blue screens, right? We've got back pain from people sitting at their computers for too long, or sitting at their gaming stations for too long. We've got shorter attention spans as a result of the information age. We have headaches, and we have social isolation. I don't know if you're aware, but they just classified, they made a classification for gaming addiction, for people who are truly addicted to gaming. It's really interesting to see where we're headed. I asked my nephews this summer, I was traveling with one of my nephews in Europe, and I was like, God, you're texting all the time. I said, I just read this article that said he's 17, kids in your generation would rather text than go out on a date on Friday night. And he's like, yeah. And I'm like, really? And he's like, yeah, because if I'm texting, I can be texting with like 6 girls. And I'm like, okay. It's a different world, right? Okay, so is that social isolation? I'm not sure, because he can't have a conversation with them, but he can text with them, no problem. All right, and where are we at with our medical system? Where we're at with our medical system is that we're currently in a pay-for-service medical system. You have to hit a threshold of bad health before you get care, and prevention is not reimbursed. So in our current medical system, we've got pay-for-service, and it's a capitalistic medical system, right? So that means that if people are paying for service, that means that everyone makes money if the person is sick. Insurance companies make money, drug companies make money, hospitals make money, you make money, as long as the people are sick. Once they're healthy, you don't make any money anymore, right? So currently, the pay scale is such that we have every financial incentive we need to keep people sick, okay? That's what our medical system, how it is currently set up. What does that mean to medicine? I want to give you an example. So about 8 years ago, 2 of our NUNM alumni have a very successful practice in La Quinta in California. And they were collaborating with a breast cancer surgeon. His name is Phil. That's all I'm going to tell you about him. And Phil, a very famous breast cancer surgeon. He's actually done the breast cancer surgeries for Nancy Reagan and Geraldine Ford, and all the president's wives would go to Phil. And he's older now. He's in his 80s. Phil had been paying attention to the fact that mammography meant that you're constantly exposing women's breasts to x-rays. And he really liked the idea of doing thermography, but the thermography technology, while Phil was practicing medicine, was not good enough to detect breast cancer. And then, in 1995, the government declassified thermography. So when airplanes fly overhead and they have to detect people in homes, that's really sensitive thermography. And all of that technology got declassified, and it was made available. And so people who developed thermography machines said, well, let's try again. And they went back to the drawing board, and they developed very highly sensitive thermography machines. Now, in the early 2000s, those thermography machines got coupled with computers that have advanced neural networks, ANNs. And these are computers that learn. So every time you would take a thermography picture of a breast, and you would positively identify it as a tumor, you tell the computer, this is a tumor. And the computer learns over time, these are tumors, these are not tumors, okay? So using that technology, Phil decided he was going to see if he could essentially do a disruptive change to the breast cancer industry. So the idea was, if you could identify a tumor, now most breast tumors happen along the ducts. So it's not just anywhere in the breast that these tumors show up. They actually happen along duct lines. So what Phil did is he started measuring women's tumors. And out of 500 women with breast tumors, the thermography machine identified 498 correctly. The 2 that it got wrong, the women actually had breast cancer, but, they actually had cancer, but it was lung cancer. So the thermography picked up the lung behind the breast. So it wasn't that they didn't have cancer, it was just that it was the wrong kind of tumor. Now, here's the advantage to that. Because you can identify as few as 10 cells that have gone out of control, You can catch tumors when they're very, very small using thermography. And what Phil could do is, because those tumors were so small and because they're happening along the ducts, he could do something called cold needle ablation, where he takes a cold needle, he feeds it into the nipple, goes right up the duct, kills the tumor. That can be done in an afternoon. Takes about 2 hours, and a local anesthesia. And now no more tumors. What does that do to the breast cancer industry? How excited do you think they were with this technology? Yeah, not at all. And in fact, the breast cancer industry has completely rejected this. Why? There's no money in health. That's absolutely right. Phil's presented this research at the national and international meetings, and everyone agrees, yep, looks like it works. Have we seen it hit the market? No. No, because the breast cancer industry is $1 trillion industry. You've got radiologists, you've got surgeons, you've got nurses and doctors, and you've got a huge number of people that are focused on breast cancer, and that's great. And if we could prevent those tumors so that you didn't need surgery and you didn't need radiation, all of those jobs go away. And that's how the industry looks at it. And I bring this up because that's what's going to be involved. Like, facing an industry like this and saying, yeah, your way works, this way works better, that's what's going to be involved in moving us to the future, to actually moving us towards health away from disease. So I think it's a good example of there's going to be some barriers. There's going to be some barriers. The other thing that we have to remember as we move into the future is that we travel, and we travel globally. So we have to pay attention to the fact that HIV, tuberculosis, and malaria have had progress in the last 20 years, but they're not gone. And because they have received a lot less press lately, you see that there's no new drugs on the market for HIV. There's also less donors willing to give money to the HIV crisis. We see multi-drug resistant tuberculosis, and there's no new drugs in the market pipeline for treating tuberculosis. But interestingly, Acupuncturists Without Borders and another acupuncture group out of Japan has been using moxa on stomach 16 to treat drug-resistant tuberculosis, and it works. So, cool. While conventional medicine doesn't have anything new coming, Chinese medicine actually has something new coming. And so this question of what the future is for global medicine has to integrate as well. Okay, so if you look up, you just Google the future of medicine, one of the first things that comes up are the TED Talks on the future of medicine. And the TED Talks are talking about the future of conventional medicine, where we have 3D printing of organs. That sounds exciting, right? So we can 3D print a kidney. How many people does that affect? 40% of the population? Nope. So we got 40% of the population who have pain, but we're working on 3D printing an organ. We've got 40% of the population who has pain, but we can now treat HIV with lasers. Cool. We can test for Parkinson's using a cell phone, and we also have dogs that can sniff out Parkinson's now. We can give people a fluorescent dye so that surgeons can see exactly where to cut. We've got gene therapy, and we've actually got the administration of vaccines through patches so that you don't have to give injections are things that are up and coming in the future of medicine. But if we look at what the main issues are that are up and coming in health, with our aging population, with informational technology, with climate change, these things are not necessarily what we need. So what's the future of integrative medicine then? Because integrative medicine falls within the conventional system, but it has more of a focus on health than on disease. We know we need countrywide licensure for the natural medicine professions. We know that we need medical models that successfully integrate care together. We know we need to fit it into capitalism, because capitalism isn't going anywhere, okay? And we need compassionate, efficient, cost-effective care. Is that possible? Yeah, absolutely. So here's what the forward thinkers are saying in integrative medicine. They're saying that we need to move away from pathogenesis and we need to move towards salutogenesis. So what the heck is salutogenesis? Well, you know what pathogenesis is because you've had those classes, right? Pathogenesis is the process of disease, illness generation, breakdown of function. Salutogenesis is the opposite. It's the process of healing and health promotion. It's the opposite of pathogenesis. And it's developing a sense of coherence for your patient so that even if your patient is experiencing trauma and change, they're resilient. That's what salutogenesis is. So I want you to learn that word. That's your new word of the day, salutogenesis. And it was coined by this group. Wayne Jonas, you may have heard of. Wayne actually started the Office of Alternative Medicine at the NIH back before there was an NCCIH. Wayne and Ron Ches and their colleagues are at a place called the Samueli Institute. Samueli Institute, for those of you who haven't heard of it, is an institute in the LA area started by Dr. Samueli, who is not a physician, but his wife was a homeopath. Dr. Samueli invented broadband, and he decided, because his wife was a homeopath, to put his millions into natural medicine. And what they've been studying is what they call optimal healing environments. So the Samueli Institute studies optimal healing environments, and they look at this concept of salutogenesis. So when we talk about optimal healing environments, what are we talking about? Well, we're not only talking about internal environments and external environments. Our external environments are what most people think of when I say optimal healing environments. They say, oh yes, you need a beautiful space. And that's true. You do need a beautiful space. And your optimal internal healing environment, you need hope. You need expectation. But there's more than that. We talked about social isolation. You need interpersonal relationships for an optimal healing environment. And you need the ability to undergo a behavior change, because that's really where our lifestyle medicine comes in. Diet, exercise, relaxation. If you can't change your behavior, you can't figure out how to do all these things. So how do we combine all of these things and wind up with an optimal healing environment? One of the things that they've shown is actually that the major influencer, so blue is inpatient, green is outpatient, but the major influencer on health, so you can see here's healing intention, ecological sustainability, healthy spaces, collaborative medicine, healthy relationships, healthy organizations, healthy lifestyles. That's where everything comes together, healthy lifestyles. So really we're talking about people taking control of their own health. And that's something that's not unusual to us, but if you look at people who are immersed in the conventional medical system, they're used to healthcare being done to them, not them taking control of their health. So if we're talking about creating a salutogenesis-based system, we have to incorporate getting people to be able to take care of themselves through a healthy lifestyle. So how do you do that? Well, obviously you change your mind. And this means that we undergo true behavior change. True behavior change means that you're doing real mind-body medicine, whereas a lot of people think mind-body medicine means that we're treating the mind and the body. We're actually using the mind because we need to change the body. And again, now let's go back to history. If you look historically at shamans and what shamans did, they would give hallucinogens and entheogens so that people would change their mind when they were ready to move forward with physical ailment. You don't have to use entheogens. You can use shamanic drumming. You can use meditation. There's a variety of different ways to get people to change their mind. But one of the things that we consistently do is we try to get them to change their body without having changed their mind. And then their body just bounces right back because their mind has not been changed. So I think thinking about this and thinking how that's going to play into your medicine and how you practice medicine is going to be important. Because the reality is, you are the future of integrative medicine. And it took me a long time to figure out how to get that fortune on that cookie. Thank you. And the best way to predict the future is to create it. So what can you do? Here's my plug. I'm going to give this plug every time I see you. I want you to publish case studies. I want you to take those patients that are complicated and write what you did for them and then write their progress. That gives us the foundation of integrative medicine and why these medicines can be successful. If you can give us the why, then we, the researchers, can take it on and show everybody how. All right, that's all. What? Do you want me to take questions? I'll take questions. Sure. I don't care. That was perfectly clear. I'm sure there's no questions.
All right. Well, thank you.
There's a question up there.
Oh.
Uh-huh. Yep. You know, that's a really good question. I don't know the answer to it. I haven't seen it showing up in the medical literature yet, so my guess is that they haven't. And I don't know if it's simply because when we just declassified the technology in the United States, I don't know how much of it made it to other countries. Interestingly, what happened with that was going to be a study that we were going to do is to demonstrate the effectiveness of thermography, is we found a guy to finance the study because the medical system wouldn't. And the guy who was going to finance the study was a gentleman out of North Dakota who had made all of his money in fracking. And Phil treated his wife for breast cancer. And so he was going to step forward and fund the research to demonstrate the effectiveness of thermography. And then he discovered that he wasn't going to be able to patent the thermography machine and sell it himself, and he stepped back. So capitalism reared its ugly head yet again. Yeah. I'm happy to go abroad. Just ask my students. Yeah, no, I think you're right. Interestingly, one of the things that I have a collaboration in Brazil